name is Austin Dudong, and I was in a group with Sarah Brookelman and Nolan Christensen, and today I will be talking to you about hand, foot, and mouth disease. First, a quick overview. This is a mild, highly contagious viral infection that is common in young children, and especially common in children who are under the ages of 5. It is characterized by sores in the mouth and a rash on the hands and feet, and it is most commonly caused by a Coxsackie virus. The main symptoms of hand, foot, and mouth, they usually appear after from 3 to 6 days after initial infection and include fever, sore throat, feeling unwell, painful red blister-like sores that are commonly found on the tongue, gums, and inside of cheeks, a red rash that is usually found on palms of hands and the soles of the feet, and also irritability in infants and toddlers and loss of appetite. There are 3 viruses that can all cause hand, foot, and mouth infection in an individual. The first virus is the Coxsackie virus A16, and this is the most common in the U.S. The second virus that can also cause hand, foot, and mouth is known as the Coxsackie virus A6, and this is usually rarer but results in more severe symptoms of hand, foot, and mouth. And then the enterovirus, this is also much rarer and is usually found in East and Southeast Asia, and is also known to cause encephalitis. And hand, foot, and mouth disease can spread through person-to-person contact with an infected person by coming into contact with things such as nasal secretions or throat discharge, saliva, fluid from blisters, stool, and respiratory droplets sprayed into air from cough or sneeze. The diagnosis of hand, foot, and mouth depends on these 3 things. Your doctor can tell if hand, foot, and mouth is the reason for what your child may be experiencing by looking at the age of the affected person, the pattern of signs and symptoms, and the appearance of the rash or sores. And the doctor may also take a throat swab or stool sample to send to the laboratory to determine the type of virus that caused the infection. Treatment of hand, foot, and mouth. There is no specific treatment for this disease, and signs and symptoms generally clear up in 7 to 10 days. However, medications can be used to relieve pain, as this is can be very painful and itchy and just annoying for a child who may be experiencing this. So topical oral anesthetic can be used to help relieve the pain of the sores in the mouth, and then over-the-counter medications such as ibuprofen, Tylenol, and Advil can also be used to help relieve general pain and discomfort. Prognosis and follow-up. The virus is very contagious, and however, symptoms are not usually severe. Most people recover within 10 to 14 days, and however, there is a slight risk of complications, and those complications include stomatitis, septic meningitis, and pneumonia. And to be safe, however, if any problems arise or continue, or if there's any questions, please visit with your doctor. And as this is a highly contagious virus, it's important to take proper prevention measures, and these measures include limiting person-to-person contact containing respiratory droplets when sneezing and coughing, washing hands carefully and frequently, and isolating contagious people, disinfect common areas, and practice good hygiene. And if you have any further questions, you can ask me or you can visit these resources.